Chances are, at some point in your life, you're going to deal with some type of tendonitis or tendon issue. In order to understand what tendonitis is, we have to have an understanding of what a tendon is, what it's made of, and what happens to a tendon as we move, exercise, and live our lives. So tendons attach muscle to bone. So whenever you are moving or doing an exercise, you contract the muscle, it pulls on that tendon, which causes the bone to move. That's how we move. What happens during repetitive activity or a new level of activity or an activity that involves more load or weights than we're used to is we can have an acute inflammation of that tendon. And that happens because of a change in the amount of collagen in that tendon. What you're going to find is that as we do things, there's a normal ebb and flow to the amount of collagen synthesis going on in our body. And I've illustrated that here on this graph. So if we're looking at this chart, this is what happens to normal collagen during acute exercise. So for the first 24 to 36 hours after exercise or after we've done an activity, we're going to have a net degradation in that collagen, which means that the collagen is going to have been broken down. We get tiny micro tears that happen in this collagen, and then over the next 36 to 72 hours, we have a net synthesis in collagen. So now our body has started to rebuild that collagen. You can see this line come back up here over that 36 to 72 hour period, and we come back to baseline and we're normal. When tendonitis happen is when we get stuck in a net degradation of collagen. So we perform an acute exercise and we don't allow sufficient time for recovery, perform another exercise or do another repetitive activity or overload. And what happens is we get stuck in a net degradation, illustrated by this blue line right here. This results in an inflammatory response at that tendon and usually results in pain. Now, usually, if this happens, we get a flare-up of pain, we give our bodies time to heal, that pain usually goes away and we might feel better. What happens is when we have this chronic inflammation or this chronic irritation of the tendon over and over and over again, we start to get into this chronic type of tendon injury that is then termed a tendinopathy. When you get into a tendinopathy, it's been going on for a while, the inflammatory stage is usually not present anymore. There's no more inflammatory markers happening, and we just have this kind of chronic pain in that tendon. For a tendonitis or for a tendinopathy, research shows that in order to help get that tendon used to load again, we have to perform a specific type of strength training, usually termed eccentric training. However, research does show that concentric training with certain velocity does help as well. But essentially what we're doing is we have to introduce load to that tendon again in order to increase what we call time under tension. So which means we want to increase how much time that tendon is under tension at an adequate level that the client or patient can handle and that tendon can handle, so that we get your body to start to understand that, okay, we have to lay down some new collagen, we have to get used to that load again, and we have to be able to reduce that pain response whenever we are starting to move or use that tendon. Physical therapists across the board often have difficulty treating this. So you have to have a physical therapist that understands how to adequately load a tendon and to progressively get that person and that tendon stronger. Usually the rule of thumb that I like to follow is when someone comes in and we're starting to load a tendon, we expect it to be uncomfortable. It's one of the few things that we understand that as we start to use that tendon, which is irritated, it's not going to feel great. So the rule of thumb that I kind of stick to is when someone comes in, I only want their pain level or their discomfort level to increase maybe a point or two on a scale of 0 to 10 while we're doing the exercise. So if that person comes in and they say, Gabe, my shoulder is at a 2 out of 10 pain, and we start to perform our loading and our weight training, and as we're going through these slow motions to start to increase that time under tension, the patient says, okay, now when I do this, it's like a 3, maybe a 4. I tell them that we're okay with that. We expect that to happen. I don't want it to go above that. It should not be higher and excruciating, and it should not be lasting after the exercise is over and causing some type of decrease in function for the rest of the day. So following those principles and those guidelines, as we introduce load, the muscle and the tendon gets stronger, and as that strength increases, inversely that pain and dysfunction goes down. In order to treat this effectively, even when you have a true tendinopathy and you're doing the correct things, it can take up to 12 weeks for a chronic tendinopathy to heal and to feel better. So make sure that when you guys are looking for a practitioner to treat this, they understand the concept of load and that you are being progressed properly in order to make the best progress.